Hi, welcome to The Journey. I'm Michael, your host, and today we're going to be visiting with Dr. Katie Woodley in regards to thyroid disease in dogs. How does it happen? Why does it happen? And what can we do? Stay tuned. Hello, everybody. Welcome to Healthy Paws. We're talking about thyroid disease in dogs. What is it? How do they get it? And how do we treat it? We're here with Dr. Katie Woodley. She's a holistic vet in Colorado, and we're going to be breaking it down today, and we're going to be figuring out how it can affect you and your dog and what you can do to help your dog if they do get it, or how potentially what they can do to avoid it. And that's one of my questions for Dr. Katie. Can we avoid it? But let's break it down. First, I would love for Dr. Katie to say hello to the room and introduce herself. So, Dr. Katie.
Thanks, Michael, and thanks everyone for being here. This is a hot topic. There's actually a thyroid epidemic going on in dogs right now, so I'm super excited to talk about it. A little background about me is I'm a holistic veterinarian based in the Northern Colorado region, founder of the Natural Pet Doctor, where I use whole food nutrition, acupuncture for my patients, Chinese herbal medicine, supplements, essential oils, all the tools and fun things that we can add in to really help your pets thrive naturally. So we offer telehealth consultations for pet parents across the world if you're not located in the Northern Colorado region. Otherwise, we come to you to make it easier for you and your pet, which is great.
What is thyroid disease? Let's start there. Or should we start with what is a thyroid?
Let's start with kind of what is a thyroid, because it'll be specific for dogs. So dogs and cats are going to be a little bit different. When we're talking about thyroid, we have to look at, okay, well, what exactly is the thyroid gland? And the thyroid gland is a part of what we call the endocrine system. And the endocrine system is a collection of glands, and they produce all of our body's hormones. So essentially, together, all these endocrine glands, so your pituitary, hypothalamus, your thyroid, parathyroids, adrenals, reproductive glands, they actually control almost every cellular function in the body. So they're really, really, really important. And so when we look at the thyroid, it's actually a secondary gland to the pituitary, and it's located in the upper third of the neck. That's where you find ours. It's the similar location for your dogs. And when we look at it, what is the purpose? What is the role of the thyroid gland? And what it does is it takes iodine from food, and it actually produces the hormones I'm going to use to say like thyroxine, which is T4, and then T3. And so a lot of times you'll go to the vet and your vet will check like a T4 to check the thyroid, and they'll say, oh, that's normal. However, when we look at the thyroid and we look at what is being produced and the hormones that are being produced, there's this interconnection with the rest of the endocrine system, and it's not super straightforward. So it's not just all about thyroxine or what the T4 is. And that's where a lot of times we go wrong in the veterinary profession, because we're only checking one value and we're missing so many hypothyroid dogs. So that's really important to keep in your back of your mind when we're going through how does the thyroid work? What is it doing? What are the different hormones that are a part of that? Also, what are some of the disease processes that can occur with thyroid, with actual thyroid gland itself?
So let's go to the next step. So when we're talking about this, so it's very much their thyroid, or it's basically in the same location. Ours is kind of in our neck. And how does disease start to form? Is it hereditary? Is it from byproducts of eating, the environment? How does it begin?
You know where I'm going to go, Michael. So there's a lot of different factors, of course. And if I see a few familiar faces here, so I know a lot of people have heard us talk about toxins and environment and things like that. And when we're looking at thyroid disease in dogs, so about 80% of cases, now there can be different types of thyroid disease. What we're going to be talking about today is hypothyroidism. So the thyroid gland is not producing enough thyroid hormones, because that makes up about 80% of cases. Of course, we can see hyperthyroidism in dogs, but that's usually because the dog is on a thyroid medication. The dosage might be too high, and that's creating a state where the thyroid hormone's too high in the body. The other cases that can happen that are very small percentage for dogs would be thyroid cancer. And so those are not typical cases. So 80% of cases that we're looking at Sorry, 90% of cases of thyroid disease in dogs will be hypothyroid. Now, from that, actually 80% of those dogs with hypothyroidism will actually be an autoimmune disease. So this is a genetically related disease. We can actually go and look at there's actually genes that they're able to identify that are related to this autoimmune condition. And what we call that is an autoimmune lymphocytic thyroiditis. So this is where that dog's body is actually producing T lymphocytes, so white blood cells that are actually becoming programmed to destroy the thyroid gland. This is actually very similar to Hashimoto's thyroiditis in humans, which is really common also in people. So this acts very similarly. So if you have a dog that's in the predisposed group where it's one of these breeds that is prone to it, so some of these breeds, golden retrievers, Akitas, Rottweilers, Dobermans, English Springer Spaniel, Shetland Sheepdogs, small terrier breeds can be predisposed to this, and also German Shepherds. So if you have a dog that is one of these breeds and they're showcasing some of the symptoms that we'll touch on for hypothyroidism, you need to make sure that your veterinarian isn't just testing T4, they're testing a full thyroid panel, which we'll talk about, because that autoimmune condition is very prevalent in a lot of our pets and a lot of our dogs, and it's creating a lot of problems. So that's a genetic component. Now, on the flip side, there's a lot of environmental components that can actually affect thyroid, just like they can for us. So when we think about what type of environment do we live in, unfortunately, we live in a toxic environment. And there's a lot of different factors that come into play. So this time of year in summertime in Colorado, there's lots of lawn and garden products. So we think about fertilizers, weed killers. You have a swimming pool, like cleaning products. Then we have pesticides. We have household cleaners, air fresheners, carpet cleaners. There's automotive products. So, your oil, antifreeze, batteries, personal care products. Like when we think about everything that we come into contact with, that can be an endocrine disruptor. So it can actually affect the thyroid gland for your pet. Now, here's the other thing that can be a risk factor for your pet developing autoimmune disease. So if they don't have that autoimmune disease process, there's actually drugs that can interfere with the synthesis or the thyroid hormone actually being made. So there's specific classes. So I'm going to go through some classes of endocrine disruptors. So aminoglycosides are a type of antibiotic that can be used. Sulfonamides, so that's typically like trimethoprim sulfate. But however, like if your pet's on a pain medication, this can also include things like Deramax. Then also carprofen, that's Rimadyl. That is a common non-steroidal pain medication. Steroids can also affect the synthesis of thyroid hormone. Metronidazole, so that's Flagyl if your pet has GI issues. So a lot of the common drugs that we're using for common conditions for our dogs can actually disrupt the thyroid gland. And then, of course, we've got flea and tick products. So super common right now. Those are a known endocrine disruptor, and alongside with vaccines. We know that vaccines are stimulating the immune system. And what can happen is that if our pets are over vaccinated, it can create autoantibodies. And what happens then? It attacks the thyroid gland. So there's a lot of different risk factors. It doesn't necessarily mean your pet's going to develop a thyroid issue, but it is one of the number one diseases that we are diagnosing in dogs for this very reason. There's a lot of different things that can cause an abnormality in our pet's thyroid glands.
What you've done here, of course, we go back to the environment and the toxins that are in our environment every single day. And you've got cleaning products, you've got lawn chemicals. There's so many things, even auto products. And then you jump to the drugs, and we always talk about the drugs too. There's, the pharmaceuticals, and you've mentioned a bunch of them here that can affect it as well. And it just once again brings me back to that whole world of holistic. Really treat your dog holistically, because the less you subject them to these different toxins, the less you're going to be dealing with so many different issues that they may get. So is there a way to tell if it's one or the other, or is it both of them just affect it the same way, and then you've got the thyroid issue?
Are you referring to like a low thyroid, the hypothyroidism? Like, is it autoimmune or is there something else going on that's causing?
Yes. What's your thoughts?
Yeah, so so typically when we're looking at diagnosing thyroid disease, that goes back to when I was talking about the beginning. A lot of times you go in, your full blood panel includes a T4, so a thyroid. And that's the only thing that they're checking. However, we have so T4, which is the hormone that's produced in the thyroid gland. However, the thing is that your T3, so we have total T3, we have total T4, we have free T4, and then we have free T3, and then we can also measure autoantibodies. That is nowhere to be found on your routine blood work. And what's really important with those, and yes, it kind of gets a little confusing, and don't worry, I'm going to give you some resources if you're in the States that you can ask your veterinarian to send that blood work to if you're worried about some of the symptoms we'll go through, is that we're actually measuring, and this is the same for people, which is really important also, because typically we're looking at TSH for people, and that's only the thyroid stimulating hormone. It's not checking what are these other values doing that are, being converted. Your T4 is being converted to T3. And the thing is that occurs 80% of this conversion process. So T3 is more active than T4. So hang in here with me for a little bit with some of the physiology, but this conversion process actually occurs in the liver. And so if there's an underlying liver problem that's not allowing that conversion to occur, then we're not going to have that active T3. But how would we know if we're not producing enough T3 if we're not measuring it? And once again, all of those environmental toxins, if your pet's receiving drugs, they're getting flea and tick medications, that is stimulating the liver. It's stimulating hopefully detox pathways. And if that liver is inundated with toxins, it may not be able to efficiently convert that T4 into the active T3 that your pet needs. So that's something that I feel like we tend to forget that as veterinarians, and we're like, oh, your T4 is fine. The other thing is too, is we have to look at the half-life of these different steps of the process. And for people, typically your T4, the half-life, what that means is how long does it take for it to be half of the level? Like how fast is it broken down in the body? And in people, it can take like 3 to 7 days for that T4 to be broken down. Whereas in pets, it's typically like 12 to 16 hours. It's really fast. So imagine if you're checking blood work at the end of the day and the thyroid is at its lowest and your vet pulls blood and they're looking at the T4 in the blood and they're seeing a low value and they go, oh, if that's all we're looking at, they're going, your pet's hypothyroid, and now they put your dog on drugs, and they were maybe not, and most likely not, actually low thyroid. They didn't have hypothyroidism. So that's the importance of these different values. So total T4 is typically what we're looking at. I'll run through this really quick. So if you have pen and paper, write these down, and because they're so valuable for figuring out what exactly is happening with your dog's thyroid gland. And so that total T4 is actually measuring the amount of T4, so thyroxine hormone that's circulating in the blood. So this is both bound and unbound. And more than 90% of that thyroid hormone is actually bound. So what that means is it attaches to proteins in the blood and never reaches the tissue. So this can be affected by anything that binds to proteins. So this is not actually an accurate indicator of thyroid diseases. It can be low if your pet has another condition going on. We call that euthyroid disease or non-thyroidal illness. And also with a lot of those drugs I mentioned, they can bind to those proteins in those drugs and it lowers that total T4. So if your vet's running that test and all they're looking at is T4, we truly don't know if that's low. So if that's the only value you're checking and your vet wants to put your dog on thyroid medication, I wouldn't do it. I would ask for a full thyroid panel. Now, some of the other things, your free T4, so this is it's in the blood, and this is a tiny fraction of that thyroxine hormone that's actually unbound, but this is the biologically active part of that T4. And so it circulates through the body. It's actually stimulating the pituitary gland. So there's what we call different positive and negative feedbacks in the endocrine system. So if we have a lot of free T4, it's going to tell the pituitary gland, hey, we don't need more thyroid stimulating hormone, which is TSH. But this isn't actually affected by protein levels. So it's not going to show, like if it's low, it's going to most likely indicate that your pet isn't producing enough of that hormone. And typically if we see both T4 and free T4 being lower, we can say with more evidence that most likely your pet has hypothyroidism. And then we move to T3, so total T3. And so this is actually, once again, just like your total T4, it's representing both bound, unbound forms of T3 circulating through the blood. So this can be bound to proteins, it can be unbound. And this, once again, isn't an accurate method of actually diagnosing if your dog has a thyroid disorder, just like total T4. But it gives us an idea like, okay, if this is low alongside free T4, total T4, then most likely what we have is a non-thyroidal illness rather than hypothyroidism. So we can go, okay, maybe this pet has Cushing's, or maybe they have something else going on. So it gives us more information as veterinarians. Do we need to search further for something that's causing a low thyroid? Does this pet have cancer? And that can actually put you on a hunt. Yes, it can get expensive, but I know if my dog has something going on and they're showing symptoms of a disease, I don't want to just put my dog on thyroid hormone and potentially cause an issue and stimulate the heart, because that thyroid is doing so much cellular function. It's helping the heart. It's increasing heart rate, respiratory rate. It's controlling organ and tissue functions. It's helping with like fat metabolism, producing hormones. So imagine what happens if you put your dog on a hormone it doesn't need, right? So that's super, super important. So that's why I like these full thyroid panels. The last one is really important, and it's one of the ones that's most commonly not done in veterinary practice. And this is actually going to identify if your pet has an autoimmune disease. And so this is actually a canine thyroglobulin autoantibody, so TGAA for short. And what we're looking at is, does your pet produce autoantibodies that are targeting the thyroid gland? And so this is with that autoimmune thyroiditis. This is the inherited form of hypothyroidism that is passed genetically on. And 90% of cases of canine hypothyroidism come from this condition. It is so important to know if your dog has an autoimmune disease, because it's just like in people. They have an autoimmune disease, they are more than likely to develop other autoimmune diseases in their future. And so this is something that is part of thyroid panels that are done at Michigan State University. Dr. Gene Dodds with HemoPet offers these full thyroid panels that are looking at T4, free T4, total T3, free T3, and TGAA. And here's the kicker. You might have a pet currently that's showing symptoms of thyroid disease, which we'll talk about next, and you check a thyroid and they're normal, or you check like a free T4, they're normal. You check a total T3 and a free T3 and they're normal. And your vet's like, they don't have thyroid disease, but they didn't check a TGAA. They didn't check for autoantibodies. And your pet can have everything else be normal, but they're showing those symptoms of weight gain and other things. And you're not getting anywhere with treatment, and your pet actually has an autoimmune disease. And so this is why it's so important to do these tests. And yes, there's an upfront cost to it. It's going to be more expensive than just running a basic panel. But if you have a dog that's going through skin disease issues, going through GI issues, you can't get control of it. You're limiting environmental toxins. You're doing vaccine titers, and you're like, I don't get what's going on. I don't understand. This test right here could change your pet's life, because they may actually have an autoimmune disease and we don't know it because we're not doing the right testing for it.
So I want to back up a little bit because that was a lot of information, and I have some questions during that path of you getting to where you got to, because there, like what you're talking about. Let's go back to the test. You keep talking about the full test and how important it is to get the full test for the T4 and the full test for the T3. But then you also mentioned that a lot of times if a vet does the test at the end of the day, that it might be a false test. Is there a better time for you to be doing this test? I know, like when we get our physicals, they always say don't eat, fast for 12 hours before. Is there any rules like that that you should be asking your doctor about before you bring your dog in, so you're not getting misdiagnosed?
That's a great question, and each pet will be different. That can be the hard part with this when we're only checking T4. So if your pet's never had, any symptoms, they look healthy, they feel healthy, there's no signs of like lethargy or tiredness, I think just running a T4 can be valuable. Now, here's the thing, like there's different levels of normal T4, just like anything. When we're looking at a conventional range of values for blood work versus looking at a more like the more Eastern standards, the more naturopathic ranges of blood values, they're going to be different for whether your dog is a puppy, whether they're adult, whether they're a senior, whether they're a sight hound, which can have lower normal thyroids, or if there are certain breeds. And that's the thing that we're not taught that in vet school. So here's my disclaimer. I was not taught that in vet school. And I wasn't taught about like running this like full thyroid panel. Like you do a T4 and you can check a TSH and see what it looks like, and you should be good with that. That's essentially what I was taught. And so your veterinarian may not know that there's these different ranges. And so there's also that compounding factor. I would say with your pet, when they're not showing, going back to the question, so I went in a roundabout way, is when they're not showing symptoms, you can run blood work at any time. With blood work, I always recommend fasting your pet. So if you know you're going to run routine blood work, fast them, because if they've eaten, it can affect values. So it'll make it more accurate for what's going on, just like it does for people. And then if there's anything that's off in that thyroid, if we find that it is a little bit lower, you can always run a full thyroid panel and have it sent off to one at like MSU or off to HemoPet, to make sure that there's not some underlying issue going on. Now, if you have a pet that has some of those issues, then in terms of maybe, should we talk about some of the symptoms that you might see now? That might be a good, okay. All right. Okay. So what are some of the clinical signs? What are some of the symptoms that you might notice? If you have a dog, this is one of the number one things that's missed. And it's also one of the number one reasons why dogs are put down. This is really important. If you have a dog that has a sudden behavior change, it could actually be hypothyroidism. So if you have a dog that suddenly becomes aggressive, or they're just not acting right, or you have, say, a puppy that's fearful, or is hyperreactive, and I mean, that can be a puppy, but like can't focus, you can't train them, and you're like, what is wrong with this dog? And that's not the normal like puppy, like crazy, happy, excited, that normal puppy. But if you're seeing behavior changes, especially in your adult, older dogs, that where all of a sudden they become more aggressive, you need to be checking for hypothyroidism, and you need to be doing the full thyroid panel. And a lot of times what happens is and I hear this all the time, is that, my vet said that he probably has a brain tumor and I should put him down. And I'm like, did you check a thyroid? And they're like, no. And I'm like, check that first. And it'll come back that they actually have those autoantibodies, and it's making them feel off. They don't feel good. And then when you start actually supplementing, you start treating the thyroid issue, your pet goes back to normal. They go back to their sweet self. So that's really, really important. Any change in behavior that you can't pinpoint, like something happened, there was like no trauma or anything, you need to be checking a thyroid. Also, because we have to keep in mind the thyroid gland is regulating the metabolism of all the body's cellular functions. So if we have reduced function, it can show up as a variety of symptoms, which unfortunately can mimic a lot of other diseases. So this is why it can be really hard to identify and to diagnose. But seasonal allergies, So it affects the skin health. It affects, hair growth. If you're noticing dull coats, if you're noticing symmetrical hair loss, you need to be checking for hypothyroidism. So a lot of times we'll see like boxers. Boxers are common for getting symmetrical hair loss on either side of their flanks. And it's like, oh, what's going on there? Check for hypothyroidism. If your pet is showing these symptoms, you need to be doing a full thyroid panel, not just T4, for the reasons that I just stated. If you're noticing that all of a sudden you have an adult dog, and they start having seizures, yes, it could be a brain tumor. Unfortunately, I've been down that path with my own dog. He was a senior pet, started having seizures. We diagnosed a brain tumor. Yes, that can be a differential diagnosis that can cause seizures in an older pet. But if you have a dog, make sure and they start having seizures, make sure you're ruling out thyroid disease, because it's very treatable, and it's so much better than having a brain tumor, believe me. So make sure you're ruling that out. More specifically, or more commonly actually, is if you have a pet that you've changed, like you've restricted their calories and they're just like gaining weight, and you're like, what is happening? Why is my dog turning into a blimp? Like, I don't understand. I'm doing all the things. I'm changing their diet. They're on a weight loss diet. We actually increase their exercise and they keep gaining weight. This could be the sign of hypothyroidism. More lethargic, more tired. And here's another one that's not super well known, is that if your dog is having GI issues, they're always getting diarrhea, they have a sensitive GI tract, we have to look at thyroid, because that thyroid is just such a part of every cellular function in the body that we have to look at that. I know a lot of people here don't breed dogs, but if you are a breeder and you find that your female dogs, they're not, like, they're producing small litters, like they're losing litters, we have to look at thyroid. And this is where I used to work at a clinic that we did a lot of health testing. We used to actually breed dogs, so bettering the breeds, right? There's good breeders, there's really bad breeders like puppy mills. And the breeders who want to further the breed and are doing things right are doing a lot of health testing. And this entire thyroid panel is a part of it. And if you're ever thinking about breeding your dog, you need to make sure that we're improving the breed. We're not just doing it because we love our dog and they're great and we'd love to have more of them. But we need to be looking at, does my dog have this genetic predisposition to an autoimmune thyroiditis? And if they come back positive for those autoantibodies, they should never be bred, because they will pass that on to the rest of the gene pool. And that's so important that we're not passing that on. So those are some of the clinical signs, some of the symptoms that you want to be looking out for. Like I mentioned, if your dog is showing those, make sure you are doing that full thyroid panel.
It seems like it gets missed a lot.
Thyroid disease?
Yes.
Oh, it gets missed all the time. Oh my gosh, it's crazy how much it's missed. And, I find one of the things that I commonly see, and there may be people here that this is currently happening to them, is that we don't know, like, your pet's showing some symptoms. So some of the weight gain, they're more lethargic. Also, they could have cold intolerance. That's another symptom. But they don't do well in the cold. It's just like people. Those are common human symptoms of a low thyroid. And your vet runs, blood work, and they see a low thyroid, like low T4, because that's part of just like the routine blood work that we run. And they're like, oh, probably hypothyroid. Let's just put them on medication and see how they do. And that is the most common thing I see, where they go on thyroid medicine, and it kind of like, it works like at the start. And I think it's because it kind of kickstarts, like they get a boost, like their metabolism kicks in and they're like kind of wired essentially. And then what happens is the problems don't go away and they might actually get worse. And what could be happening is that we had what's called a euthyroid syndrome. Euthyroid means that the thyroid is suppressed not because of a hypothyroid condition, because the thyroid gland's not working, but it's suppressed because there's actually another disease process that's occurring, and we completely missed it. And we just symptomatically treated with a thyroid hormone. This is really detrimental, especially like for senior pets, because think about what the thyroid hormone is doing. It's increasing heart rate. It's increasing respiratory rate. It's doing a lot of different things. It's producing calcitonin. This is a hormone that's involved in like calcium metabolism and blood calcium levels. And so it's not something that's just like very benign, like it's not going to lead to issues. We can actually put pets into hyperthyroidism. We can actually cause heart issues by using wrong dosages of thyroid or medicating dogs that actually don't have hypothyroidism and shouldn't be medicated. So this is very, very, very common. I've seen it throughout my career. I've been in practices where I've seen this recommended, and it's something that, making the recommendation. And yes, there's nothing wrong with saying to someone like, these are your options. This is what I recommend. Here's the cost. And if as a pet parent, you're like, I can't afford that, let's try a really low dose of this medication and see how my pet does. That's okay also. And I want people to feel okay with that, but you have to be given that option, and you have to be given the advice that there could be something else going on, so that you're given that informed option. And it's not just like, oh, just try this. It'll be fine. Let's just see how it goes. No, you need to be given all of those different options. That's what's so important about us as a veterinarian. We should be giving you, here's gold standard. This is what it costs. This is why we're recommending it. And then going from there and working together to make the next decision together, what's best for you, what's best for your pet, what you're able to do.
So it sounds like to me that you're talking a lot about Eastern medicine here and Western medicine, but more Western medicine here with the thyroid. What do you recommend?
So this is one of the things where I am a holistic veterinarian for anyone that just joined. And if we are diagnosing a thyroid issue, we need to be putting them on thyroxine. So that's a synthetic thyroxine. Now, some people are like, I don't want to do it. And so that's okay too, because we actually have natural thyroid extracts that are made from like cow and pig thyroid glands. Now, here's the thing, is that those products are human products, and they contain both T4 and T3 thyroid hormones. So the veterinarian has to be able to adjust that with that in mind. So they tend to cost a lot more also. So that can be a limiting factor for a lot of pet parents. But this is where if we're identifying a thyroid autoantibody, so you're doing that full thyroid panel and they're coming back positive for the autoantibodies, you need to be actually medicating, because what happens is if we don't slow down that process, even if your pet's completely fine, like you're not seeing any symptoms and you ran this full thyroid test to just know, like, where does my pet stand? We need to actually be giving them thyroid hormone, because what it does is it calms down that autoimmune response. And so it takes pressure off of the body so that it doesn't ramp up and continue to attack the thyroid gland. Because here's another thing. When a lot of veterinarians see that, they're like, let's just wait and see. Like, I hear that all the time. And I'm sure a lot of people here have heard that. Let's just wait and see until there's a problem. And I'm like, what are you waiting for? To like get a diagnosis, to like watch your pet get sick? No, let's take preventative action, proactive action, and do the things to help the body. So that's where, if you're seeing those autoantibodies, a lot of times we are using a low dose of thyroxine to support your pet. But here's the thing, this is the more natural thing. So if you're like, oh my gosh, who is this person? She's not a holistic pet. There are natural supplements that we can use. So I use a lot of standard process in my practice. They have a human line, they have a pet line, and it's all about whole food support. And they use a lot of organ meats. We can use thyroid extracts to support a low thyroid. So we can add that in. We can use things like seaweed. We can use kelp that are a natural source of iodine to support the thyroid. Remember, the thyroid is taking food and taking the iodine from that and turning it into T4, T3 to help those cellular functions. Now, you have to be a little bit careful, because there is some mixed research out there about whether supplementing with like iodine is actually beneficial or is it going to create harm, but we can use low dosages. And this is where I love using, so specifically standard process, so thyrotrophin, PMG. So this is given to people, humans, with the Hashimoto's disease, which is very similar to the autoimmune thyroiditis and lymphocytic thyroiditis in dogs. And it helps slow down the autoimmune reaction. So for pet parents that don't want to use drugs, I'm putting their pets on that. I'm also there's a canine thyroid support supplement from Standard Process. they're getting both of those to provide extra vitamins, minerals, nutrients, thyroid support in whole food form. So those would be two natural supplements I would be using regardless. And sometimes we can keep that pet off of thyroid hormone, but you need to be checking also the autoantibody levels to see, is it increasing? So we can recheck those values and actually determine how well is our treatment working. We want those levels to go away. And we can actually see that sometimes using just natural remedies, but also if we are using thyroxine, which is the synthetic hormone replacement, those levels should be going down, going into a normal range. Some of the other natural things that I use, we've talked about essential oils here. I love essential oils. So specifically for thyroid support for a dog, I tend to use lemongrass. Lemongrass and myrrh, so MYRRH, are really, really, really helpful. And what we can do is we can actually create like a 3% dilution. So what that means is essentially, to keep it simple, 3 drops of each of those oils. So 3 drops lemongrass, 3 drops myrrh, and you can add that into 100 drops of a carrier oil. Yes, it does suck. I just told you to do 100 drops into like a glass bottle, but the carrier oil could be something like olive oil, could be fractionated coconut oil, just any type of carrier oil. And then what you do with that is you can actually take just a little bit of that and rub the front part of your dog's neck where the thyroid is. And you can rub it anywhere. Essential oils are absorbed into the body. They're absorbed into the cells really fast, and they're distributed throughout the body. But specifically, just rubbing that area where the thyroid is a couple times a day, and you can use that for additional thyroid support. I wouldn't use that by itself, but it's just another complementary natural remedy that we can use alongside, say, standard process whole food diets, which we've talked about. Those are so important. Get your pet off of processed foods because of all the chemicals, the additives, all the things that we don't want in our pet that can affect thyroid function. So that's kind of where I'd look at is I'm not against, this is a case where we need to be using potentially that synthetic thyroxine at the right dosage. That's very, very important for your dog, for their life stage, for their breed, for their size. That's very important, and those can vary. So we have to keep that in mind. But there are definitely natural alternatives, but also complementary treatments that we can use alongside to support your pet's overall thyroid and immune health.
Well, and I appreciate that you're so honest about that, because sometimes people are like so determined, like, oh no, it's all got to be holistic, it's got to be that. But there are those moments where, the Eastern and the Western side has to work together in certain situations. And this definitely is one. I want to back up. You were talking about, getting tests. I actually had a room the other day with Paw Print Genetics. And she was talking about Lisa was talking just about what we're talking about today, is that you can actually do these reports, and you can actually get a report on your dog and actually see what the genetics are of that dog. And you can see if they have this precursor to this potential. Is that correct, Dr. Katie?
Yeah, I wonder if she's referring to the thyroglobulin autoantibodies. There's so many. One of the cool websites that even like if you're not a breeder, I felt like this website is fascinating because you can actually look at it and see what genetic diseases your dog is predisposed to. And it's the CHIC website, so Canine Health Information Center, so CHIC. And you can go there. We used it for the breeder side of the clinic I used to work in. And these were the different health tests. So do they need certain eye tests, or do we need to be checking for congenital heart defects, the thyroid specifically for a lot of those breeds, MDR1 mutations. So there's a lot of different things as we're doing more with the genome and genetics that we can look at. And I'll tell you what, if I know that my dog is predisposed to something, so say like I love my German Shepherds, and they're predisposed to a lot of different things. If I know that cancer is a huge risk, that degenerative myelopathy is a huge risk, I am going to be doing as much genetic testing as I can, because for one, I'm going to be using as much natural remedies, whole food to like support their immune system. So I feel like the more information that pet parents have with those tests is very it's invaluable. Like you can do so much with that. It's definitely worth looking into. And I know, Michael, I think you posted that on your YouTube channel, right?
Yes, it's there. Yes.
Yeah, so I think everyone go to Michael's The Journey YouTube. I'm doing a plug for you, Michael,
I love
because
it.
he's reposting these, and YouTube's a great place for information to live forever. So check that out, and then check out the Chick website, and take a look. Go to hemopet.org and take a look at Dr. Jean Dodds, and what she has an entire thing on thyroid disease. We're doing an entire 2-hour webinar on Sunday for thyroid disease for dogs and cats, where we're going to be going more in depth with these testings and also natural remedies and also food, because we can use different foods also. So food as medicine, where we can actually reformulate. Like I use a lot of Chinese herbal medicine, and I'm not touching on that right now because I tend to look at different patterns that the pets present with. And then what we can do is we can use different Chinese herbal remedies for that individual pet to support them. And if we are diagnosing your dog at an early stage where maybe there is only the autoantibodies, a lot of times we can use the Chinese herbs, we can use food, different types of food, and we can use some of those supplements and essential oils that I recommended, and we stop that process. Like we're like, nope, you're not continuing this autoimmune destruction, and your pet does fine and doesn't need any of those synthetic drugs. So this is where utilizing all of those resources and all the different areas of holistic medicine, integrating them in, of course, when needed with conventional, because there is a time and a place. But there's so much that we can do, and there are so many resources for pet parents out there. And yes, it can be super overwhelming, but look to the guides, follow what other people are doing, get the books. Dr. Jean Dodds also has a book that is amazing. Like she has like what doses you should be using for different size breeds, what ranges of thyroid, like T4, where your pet should fall. So this is great because now as a pet parent, you can have this resource in your backhand or back pocket, and you can get the test done. And then you can take a look at the results and you can go, wait a second, like my pet's in this range. And then you can ask your veterinarian and have an open conversation about that and be an advocate for your pet.
Going back to the test real quick, and you said like if your dog's has these preconditions that are come with their breed, it's wonderful to have these tests, because when we were talking about these genetic tests, there's so many different tests for different parts of for your dog that you can have, and it just really sets you up. So like Dr. Katie's talking about is how are you going to, what's their nutritional value that you're going to be given during their lifetime? How can you change this path? Because just because they have it, the markers inside the DNA doesn't mean that they necessarily get this. Correct, Dr. Katie?
Yes, I love that you said that. I see so many people being like, well, they're screwed. They have the genetic markers. And it's like, no, 90% you can change. 10% is genetics. 90% we can change with environment, with supplements, with food. That is how powerful it is. And here's the other thing. Like when we look at how do we support a strong immune system, like that is vital for your dog's health. What does that look like? What types of foods can we feed? Food is the foundation for health. That is always my go-to, because they're eating every single day of their life. So that is very powerful at affecting their immune system, whether it's harming or helping them. And then if you have a pet that has these markers or has these autoantibodies to the thyroid, we can look at, okay, well, they're due for their vaccines. And what does that mean? Okay, let's do a vaccine titer instead. We should not be vaccinating these dogs that are prone already to autoimmune diseases, because we will stimulate the immune system and it's going to create more potential issues. So that's really important, and that's where that information is so powerful. But I don't want people to feel like, I found this, it was interesting in vet school. So years and years and years ago, I had Finn, my German Shepherd, and my best friend in vet school, she had a Doberman. And we used to take notes in class, like we would do like tick marks for which breed was worse off. And like because you're going through learning about all these diseases. And I was like, oh God, there's one for a German Shepherd. And she's like, nope, Dobermans beat you this lecture. And the thing is knowing what I know now, like there's so much we can do to prevent those diseases. So it doesn't mean just because your German Shepherd is predisposed to a splenic hemangiosarcoma, it doesn't mean that they're going to get it. Yes, they're at a higher risk, but we can do so many different things to help them. And it doesn't have to be hard things. So when I say so many, I know people are probably, this is overwhelming, right? So that's where adding in leafy greens, steam leafy greens, your kale, your spinach, adding in broccoli, or even adding in broccoli sprouts. They're super easy to make. I can make them. Anyone can make them. And adding those in, they're going to provide additional phytonutrients to help reduce the risk of cancer for your pets. I always go back to the study by Purdue University, 2006, where it showed just doing that 3 times a week reduce your pet's cancer risk by 90%. That with a kibble diet. That's how powerful just adding in a few things. So if you're eating it, set some aside, put it in your pet's food. Like simple, easy little things that you can do each week to help your pet thrive. It's going to help you thrive also. And it's going to help reduce some of the risks of things like thyroid disease, cancer, a lot of these other conditions that we talk about.
We've covered a lot here, and I love that we do this all the time. You're such an incredible source of information, and just your passion and your mission that you bring to the rooms, and just your knowledge. It's just so robust, and I just love it. Is there anything that we haven't really put our finger on, like right now? Like, is there a certain age that the thyroid, this condition, can flare up and that people should be more aware at a certain time in a pet's life? Or, we're always talking about healthy nutrition, make sure you're feeding them right, be holistic with your animal, set them up to win the first day you get them. But let's say they've had a dog and they've been not necessarily feeding them the best food because they didn't know any different, or they don't know any different, or whatever. We always talk about that. It's not about shaming about the past. It's about, here we are, we have a dog that's, let's say 3, 4, 5 years old. Do we start looking for these signs, or are these signs so obvious that when they do show up, that they do show up?
That's a great question. And one of my goals for every single pet, for my own pet, is to figure out if they have a disease condition before it becomes a name that we can give it. And what I mean by that, so specifically thyroid, if we can find that your dog has the predisposition to developing like full-blown thyroid disease by checking a full thyroid panel and looking for autoantibodies, that's a lot easier to treat than if like the thyroid gland is completely exhausted and we have adrenal dysfunction. So doing at least, if you're like, okay, I'm ready. This is day 1. We're moving forward. Forget the past. Great. Fantastic. Do a full thyroid panel and just check, check for those autoantibodies. That's really important. But here's the thing. What they found with studies is that our spayed dogs, our neutered dogs, are at higher risk. And it's because of the sex hormones and how it affects that hypothalamic, pituitary, thyroid axis. So remember, all of these glands are part of the endocrine system. And so when we neuter and spay our pets, there's good reasons to at certain ages, but it can actually increase the risk of thyroid disease. So what I always say is that, getting baseline blood work. So if you have like a new puppy and you're like, okay, I want to do this right. It's kind of like where I'm at, coming from Finn and going through a lot of cancer with my pets. The next dog, I'm like, okay, let's get a baseline. So dog's normal, healthy, happy. Let's get a baseline. And then doing blood work, if you can, every single year, will give you an idea if things are changing because we can track trends. That's really important. And I can tell you what, that the value in that by itself is astronomical, because I can tell if all of a sudden creatinine is increasing, or why did that T4, even if we are just checking T4, why did it drop? Maybe we should do a full thyroid panel, even though it's still within the normal reference range. And then as your dog gets older, we have that reference range from when they were young and healthy, and we can compare it. So I think, like, especially if you have a neutered spayed dog, which most of us do, that's very important that we're at least checking a thyroid panel at least sometime to see if they have those autoantibodies, because it's pretty crazy how many of our dogs actually do, and we're missing it until it becomes full blown and we're seeing them with, skin issues, GI issues. They're not able to lose weight. They're getting heavy and obese, which is leading to other health issues, can predispose them to diabetes. So there's a lot of benefit, I feel like, in doing that routine blood work and checking these things. And that thyroid panel doesn't have to be all the time. There's smaller panels you can run. And that's why I love Dr. Jean Dodd's book. So Canine Thyroid Epidemic. She has like diagnostic testing and interpretation for an entire chapter and tells you, like, if you can't afford this full panel, this would be the next step, or this would be the follow-up. So I love that, because as a pet parent, not everyone can do all the things all the time because it does get expensive, but at least you have like the basic things that you can do every now and then to make sure we're keeping tabs on our pets so that they don't get to a point where, they've fallen off the cliff and now we're trying to climb back up, which tends to be a lot more expensive in the long run and more stressful.
You always say this, and I think it's so important, is always be proactive than reactive, and just really keep your finger on your pulse. And we always talk about this too, who your pet is today. Who is your pet? What's their health today? What's their age today? What is their time frame that they can actually exercise? I mean, there's so many things that you got to keep your pulse on, and just being connected to your pet. If you're a parent that's connected to your pet, this is not a big thing. Even though it sounds like a big thing, you'll be able to see these minor things that change inside your pet if you're really connected with them. We are at the top of the hour, Dr. Katie, and I know that we close at the top of the hour to respect everybody's time in the room and your time for being here. What would you like to close out with today?
I think everyone who's here, like, learning about these different things, I know we kind of went a bit technical with, especially the diagnosing and the T4 and all the different values. But I want you to know that there's a lot we can do to support them. And a lot of the things that we talk about in this room, they can be used not only for thyroid disease, they're used for maintaining your pet's overall health. So keep learning, keep researching, and keep applying. That's the most important thing, is keep applying the tools that you're hearing about. Like, if you need help with the standard process stuff and you can't get it, reach out, send me a DM, and I can give you an access code. So you can, especially if you have a dog that has thyroid issues, get them on those supplements, because it's going to support their overall health. But there's a lot of people here that really want to help. I know Michael's just an amazing person for facilitating all these people coming together. And I feel like there's so much information, but start small. We always talk about what's the easiest thing that you can do. And maybe it is that you just do the thyroid panel, see where your dog is at, see if they do have those auto antibodies. And if they don't, fantastic. Now what can we do to support their overall immune health? And if they do, okay, and they're not showing signs, there's still those essential oils, there's still those supplements that you can use. Make sure that we get them on a whole food diet, so we're supporting their immune health to keep it from progressing, because we can. That's the thing. You can keep disease from progressing. You can reverse disease. Even if they say you can't, I see it every day with my patients. So I appreciate each and every one of you for being here and learning more, because that is the most powerful thing. And I just absolutely, you guys are why I do what I do.
Everybody, definitely check out thenaturalpetdoctor.com. She's on Facebook. She has such incredible information for you guys as always. So Dr. Katie, thank you for being here.
That's the thing. Like, a lot of us are creating a lot of content, and it's specifically for you pet parents, because as I've found out through my journey with holistic medicine and starting off conventional, I wish I knew this from the right from the beginning with my own pets. And as Michael stated, we can always start today's day one with ourselves, with our pet's health. So don't be afraid to just start implementing those changes, but also, like, go and check out all the free resources. We have our YouTube channel. Check out Michael's YouTube channel. Check out all of our resources at our blog posts at thenaturalpetdoctor.com. There's so much there for you for free,
Yes.
which is just it. Anyone can take any of that and start implementing it, and it will make a huge difference to the life of your pet.
We say that all the time, baby steps here in Clubhouse. And really, through all the videos that we have, through all the videos that Dr. Katie has on Facebook, she has these groups that you can join. Definitely join. All her links will be also included in the description on this podcast that hits the YouTube. So if you forget them or you want to look for them, you just go to the journey again. You can go down in the description. You can find all her links. I think I've got 5 or 6 links there for her. So definitely take advantage of her knowledge, her passion. I think it's more of your passion that just I adore, because it's your passion that just allows you just to be that little nerdy person that's like seeking out the next thing, isn't it, Dr. Katie?
I love that. I am a huge nerd and I love learning all the things. And I think that's why there's so many different things I talk about, from essential oils to herbs to nutrition, because they play a part in so many different ways. Not everyone has access to Chinese herbs. And so that's where it's like, okay, well, what food do you have? Everyone has to eat. So what foods can we use? You know, a lot of people have access to essential oils, which is fantastic. And I love, like, around the world, which is incredible. So we can use like whole plant sources. We can use things like CBD. Like, I love it because it's like opened up my entire world and given me so many other options to treat pets. Whereas I was so limited and frustrated when I only had conventional medicine. It was like, what is this? Why did I do this? Why did I go to school for this, to tell people like, sorry, there's nothing more we can do for you? But the holistic side has just changed my entire life. Unfortunately, I found it because my husband got sick with autoimmune disease, but it's a blessing in disguise because we've been able to help him with holistic, and I was able to integrate that in with my patients, and the world it opened up. Oh my goodness, it is just amazing. And I'm so excited you guys are all here learning about it, because there are so many options for your pets. If one thing doesn't work, that's okay. We'll figure it out. We'll find another way. And that's what I love. It stimulates my brain, and there's so much more. And Michael, I just love it. As you know, you're part of the holistic world, and it's just, there's so many amazing, cool options for people and pets out there.
I totally geek out with you in the sense of, like, I can't believe how much I enjoy doing what I do here on Clubhouse and being able to bring like you and everybody else together and have these conversations, and just being able to provide this wonderful solution for people that they can go somewhere and to be able to reach out to you and get free information. And these are all baby steps. So I'm a total geek at this right now. I can't believe how much I'm geeking out in Clubhouse and geeking out here in the dog world, but I just really, really enjoy it. And I enjoy that everybody follows me and joins me in the rooms, because it just supports our channel and just supports Dr. Katie and everybody else that comes here. You know, we're coming from our hearts, and we really want you guys to win. We want your dogs to win. We want you to come to the rooms and listen to Dr. Katie, or listen to me, or listen to anybody else that I have on the stage with us, and walk away and go, oh, wow, I never thought of it that way. Oh, wow, I didn't even know that. And I always talk about, this is all about what we don't know. And this is why we're doing these rooms, is so that we can bring one little bit of information to you that you don't know. So with that, Dr. Katie, is there anything that you think that we want to share that might be one of the things that I don't know?
That's great.
Do you like that?
There's always things that we don't know,
right?
You know? So I love it.
I'm harassing you. You know, I always harass you.
I know. So, once again, I appreciate everyone. And actually, one of the things I did want to leave with people is, we did this morning on Facebook and Instagram at the Natural Pet Doctor. We did a natural remedies for anxiety. And I believe Michael also has a YouTube where we did a Clubhouse talk on that. But coming up to 4th of July in the state, thunderstorm season, make sure you check out that YouTube video that Michael has, and then also check out our live that we did today on either of those channels, because it's free. And there's a lot of resources and supplements that I recommended that can actually help you get through some of the most stressful times this coming weekend. So take advantage of that and get them on board now, so that way it's less stressful for you and your pets next weekend.
Yeah, definitely. And that's so important what she's talking about is like we are on the countdown right now to 4th of July. And if you're in a big city, you already feel like you're in 4th of July like we do here in Los Angeles. And it is a scary time for our pets. So there's so many different ways to help reduce that anxiety. And yeah, Dr. Katie and I did the 4th of July ones. There's a couple of them on the YouTube now. And definitely check out Dr. Katie's and find some solutions. Get your dog ready. Be prepared. Be safe with your dog during the 4th of July. We have 8 tips on our website of how you can set your dog up to win during 4th of July. So you could check that out. There's so many resources. So definitely check out Dr. Katie's, which she filmed this morning. Is incredible information for you. So with the 4th being here, let's get through this without a big bang for our dogs. Dr.
I love that. No bangs for our pets.
No bangs for our pet. So, well, Dr. Katie, thank you so much as always for being here. I just enjoy your passion, your mission, your understanding of the ins and out of the holistic world. And, you know, sometimes the universe brings it to us in the strangest ways, but the beauty that comes out of it sometimes is so beautiful. And what you're doing and what I see that you're doing. And I love that. Once again, everybody just know that she's available anywhere in the world, because she does telemedicine. And I think that's just a dream. And that's what we've been finding here in Clubhouse, is just being able to connect people from around the world. So Dr. Katie, thank you for being here today.
Thank you so much, Michael. Thanks everyone again, and have a fantastic weekend.
Yes. Thank you everybody for being here. Have a beautiful weekend. Thank you for joining us here in Clubhouse, and be sure to check out Michael the Pet's Journey on YouTube. We will see you here soon. Thank you for joining us. I'm Michael. I'm out.
Bye, everyone.
Bye, guys.